This video is for lash lift, and we are going to start our lash lift video as if we've just gotten to work. So upon arrival, you're always going to wash your hands. So you're going to go to the sink, wet your hands, and then find your liquid hand soap, get a coin size, and you're going to wash your hands down to your wrist. You're going to wash the back of your hands to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers, of course. You're going to wash your fingertips and your nails. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrists. And you're going to do all of that focused wash, interlocking fingers, for a minimum of 20 to 30 seconds. And when you feel like you've gotten really, really clean, you can give it a thorough and proper rinse under the water. When your hands are rinsed thoroughly, you can get either disposable paper towels or a clean towel, and you'll turn off the faucet with the towels, dry everything off really nicely, throw your paper towels in the trash, and then if you used a clean towel, it's now dirty, and you're going to put it in your closed container that you're going to do laundry with later. Once you've done that, you're going to find your hand sanitizer with 70% ethyl alcohol, and you're going to sanitize, and that's how you're going to finish your hand wash. So you're going to take care of that. So you know that your first appointment of the day is for a lash lift, and so what you're going to do is prepare your room and your tray for that. So let's talk about how we get our room set up and ready for our client. So we are going to disinfect our workstation, bed, and equipment using a disinfectant wipe, and of course following manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll dispense products needed for the service. We're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or we can remove the product with a disinfected or clean single-use spatula. Close the lid to the product and set the portion cup tray on the tray. We'll drape the facial bed using one fitted sheet, one flat sheet, and 3 towels. We'll place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. We'll lay a hairnet and a headband on top of the first towel along with a roll towel to support the head and neck of the client. And then we're going to save the third towel to lay across the client's décolleté. You can also use disposable table paper if you prefer to drape the bed. So we are going to, we have set up our tray, and we're going to review that. So the bed is made. And then what we've got here for the lash lift service, I want to show the tray that we have what we need to perform the service and that it's set up. So of course we have cotton rounds. We have some 2x2s and some 4x4s. We have wooden stick Q-tips, and we have water, makeup remover. We have like a barrier cream that would be something like Vaseline to help hold the disposable iPads on, which we have disposable iPads right here. We have our lifting lotion, and then of course we have our setting lotion. We've got our lash glue and our implement, our tool to help put the lashes on the rods, which our rods are right here for the lash lift. And then I have brushes to apply the product for the lash, the lifting lotion and the setting lotion. So I have all those implements. I also have disposable mascara wands here. And of course I have disposable gloves. I actually have 2 pairs of disposable gloves. I've got a backup if I need it in case something happens to the first, but I have a box of disposable gloves here always. Of course, got my trash can. And I have followed all the instructions and set my facial bed up ready for the client. So the next step that we're going to review is our client consultation. And just note that, of course, when I go and meet with my client, I have clean hands. I'm going to wash them again before I perform the service, but I just want to make that notation that, of course, when I meet with a client, I always have clean hands. So I'm going to meet and greet my client and escort her to the work area. I will assess the client's current style and determine the client's preferences. I'm going to assess the client's needs, and then I'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, something like lice, to prevent from safely performing the service. I'll assess the client's consultation form for any medications and products used within the last 72 hours, and I'll consult on any known allergies. I'm going to consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, I'll assess if the client is prone to cold sores or fever blisters. I'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. I'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from any of those contraindications, you can move forward with the procedure. So our girl is fine. So we will be able to move forward with the procedure. So the first thing that I'm going to do is get that client comfortable, and then before I get started, I'll be washing my hands again. So for this service, the client does not need to disrobe. We simply will get them on the facial bed, comfortable underneath the sheet, blanket, and then I'm going to give this rolled towel here, and I'm going to place that under her neck to get her a little bit more cozy, give her some support. I've got my hairnet here that I'll apply to keep the hair out of the face and away from the lashes. And then I have that extra towel that I am going to drape over her, and I'm going to go ahead and take it all the way up under the chin. So I would be covering clothing, or if she has any skin that's out, just nothing's going to go there, but you just want to make sure nothing goes there. That's always the safest route. So she would be ready now, and she can relax and close her eyes, because until I'm ready to get started, we're just chatting and talking, and then now it's time for us to for me to wash my hands so I can put my gloves on, because you will be wearing gloves to perform this service. So you would go to the sink and wet the hands again, and find that liquid hand soap, a good coin size of amount, and then you're going to wash your hands down to your wrist, and you're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash your fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. And you're going to wash those thumbs. You're going to wash your wrists. You're going to do all of that interlocking motion for a minimum of 20 to 30 seconds. When you feel like you've gotten everything nice and clean, you can really do a nice, thorough, proper rinse under the water. And when your hands are rinsed off, you're going to grab paper towels, disposable paper towels, turn the faucet off, or a clean towel, turn the faucet off. Dry your hands off, toss the paper towels, or put that dirty towel in a closed container until time for laundry, and then get your hand sanitizer, 70% ethyl alcohol, sanitize your hands, doing all the same things to finish your hand wash. And then when your hands are nice and dry, you're going to put those disposable gloves on. So that's kind of the hardest part when you are sanitizing. Just make sure your hands get dry before you go put your gloves on. And I'm going to put on my disposable gloves. And then you're ready to begin the service. So the first thing that you're going to want to do is remove any eye makeup remover that she might have on in that area, so that you can perform your lash lift. So we are going to just use some cotton rounds and some eye makeup remover to take off any makeup that she might have on. Just remember, of course, that every client is different, and she also knows the before and after, that she won't be wearing makeup or getting her lashes wet, etc., for a little bit. So She might be coming in with mascara on. I'm just being a little cautious here because I'm working on a mannequin and I'm going to try to have these rods stick to her. I have put a little bit of double-sided tape on her lid, which hoping that the rod adheres to that. So we're gonna find that out in a minute, but it just made little cotton fuzzies stick on her lashes. So I'm just gonna be very delicate with the makeup remover part so that I don't put any makeup remover on my double-sided tape. Obviously on a real client, I would not be doing that. And then I'm going to dry the area nicely. And then I'm going to apply that barrier cream so I can place the iPad on. And it just helps protect but also keep the iPad in place, so it's going to stay where it's supposed to stay while we perform this service. And then when you apply your disposable iPads, you will actually be applying them on top of the lower lashes and the lower lash line because you're only lifting the top lashes. So once again, make sure you cover up with your pad the lower lashes and that lash line. So you're just focusing on the top lashes with this. You are not lifting the bottom lashes. Make sure everything's nice and smooth and as close as I can get it. Perfect. So what I'm going to do now is apply the rod to each side of the eye, and I'm really hoping that this tape will help me get it to stick a little bit. So you would normally be putting a little bit of lash glue, and then you'd be putting the rod down and it would be sticking to the client's lid. And then you may want to hold it for 5 to 10 seconds or whatever you feel like, just to get it to stay. Mine might not stay as well until I get the lashes to the rod. That seemed to help my videos yesterday, so I'm going to leave it here and just try my best. If it doesn't stick now, it's okay. I just know that that double-sided tape might help me in a minute when I try to do the lash lift portion. Yeah, it doesn't seem to be the best right now, but it did help a little bit yesterday for our other videos. So we're going to try it again. So I'm just taking the rod and I'm placing it as close as I can get it to the base of the upper lash line. Just getting, there's a little lash underneath here, a couple little lashes underneath it. And I'm not sure if it's really going to stick until I start to work with the lash glue, which is what I'm going to do. So I'm going to try to just use one hand to kind of hold that down, and then I'll start applying the glue and then the lashes. So I've got my glue that I'm going to be applying to the rod, and then I am going to use my tool to get the lashes to adhere to the rod. And when I'm working here, I'm just going to take my time and knowing that how I apply the lashes to the rod, I'm going to take my time to make sure that they look really, really good, because when we get on the other end of this, I want them to look great. When we put that lash lifting lotion on there, I want them to, they're going to stay how we put them on the rod. So I want to make sure from the very beginning that I do a nice job of making them look the way I want them when I'm actually putting them on this rod. I'll take the time to separate them and everything. And so I'm just going to take a minute now to just make them look the way that I want to. Make sure they're all going in the same direction, that there's no like little clumpies, no crookeds. Okay, and I'm going to just repeat that process on the other side. And you just have to be precise, take your time for this part. It's just, this service just takes time, and that's okay. That's why you block the time for this service. That's why people pay for this service. It takes time. And I'm taking a minute here now as I'm finishing this side with the gluing to comb through, make sure everything's facing the direction I want it to for the lift. Etc. And then you have your lashes then on the rod. And now it would be time for you to apply your lifting solution. So I'm going to be using a brush to do mine. And what you want to do with your lifting solution is to make sure that you take it up 3/4 of the way, our lifting lotion, I'm going to start at the root of the lash where it really matters and then work my way up. But I'm only going 3/4 of the way up. I'm avoiding that very, very end of the lash because that's the weakest part of the lash, like it's the part that's getting ready to shed away. So I want to make sure that I don't get it to look yucky. So once again, not to the very, very end, but making sure I'm getting it really applied well to that root where it matters. And then I'm going to go to the other side. And then I'm just gonna cover her eyes here for a second. Because you're gonna follow manufacturer's directions, of course, but you want to note how long that you would be lifting the lotion, like having the lift lotion on. So we're gonna say for this particular product that we're using that it's gonna be 5 to 10 minutes that you would leave it on. Just note that some people's lashes may process faster, even as quick as 3 minutes. So we are doing the video, so obviously we are not going to sit here for 5 to 10 minutes, but just so you know that we're gonna pretend like that time has elapsed and that she's had her lifting lotion on for that amount of time. So now we're gonna remove the lifting lotion. So I'm gonna take off her cotton rounds and her towel, and I'm gonna start with a little dry remove, and I'm going to be going up and out onto that rod, and then I'm going to go in with a damp. So I'm just going to be really gentle like I always am around the eye area anytime we're working anywhere in these sensitive areas. Dry real quick here, and then we're going to do damp. And now I'm going to go in with some damp. And it may take as many as, 3 passes. You just be the judge as you're working. It's good. So now that we've done that, it's time to apply the setting lotion. So I'm going to use a different brush and I'm going to apply her setting lotion. And once again, you're going to follow your manufacturer's directions. So we're going to give her a little coverage here just so she can rest while the setting lotion is on the lashes. And for our intensive purposes, we're going to say that our setting lotion, we're going to let it sit there for 5 minutes. So we'll just say that that 5 minutes has elapsed because we are doing a video. We're not going to sit here for that 5-minute time frame. So I'm going to take off the coverage. And once again, I'm going to do that dry, damp, damp, dry, damp, damp. So we're starting off nice and dry. And now damp. You may see that the lashes will start to separate from the rod, potentially. And then I'm going to take a damp Q-tip to try to make that completely happen really gently. Just getting these that are already kind of separating. Helping them along here. And what I'm going to do is I'm going to gently remove the iPad that's disposable to dispose of it. And then, of course, I'm going to gently remove the rod. With my damp, I'm able to now can work in the other direction as well. Boy, this glue, guys. I think it's a combination of the glue and the cholesterol. Seems like there's a lot of cholesterol on lashes. or glue. I'm not sure which is the bigger influencer there. Let me use this disposable mascara wand. It's everywhere. Try to use a 4 square here and gently get it off that way. All right, I'm going to leave this side and move on to the next. So dry, damp, damp, dry, damp, damp. Which of course helps it then. The damp helps it release from the rod. So you're getting that setting lotion first with a little bit of that dry wipe, and then you can get in there and really get the lashes to release from the rod. And then you can go back with any additional, with this Q-tip to really help any additional that are just really nice and sticking really good, which is great, but we're going to get it off. And I'm removing the rod. I'm also taking off my disposable iPad to throw away. And I'm going to take a nice little damp, again, to continue that cleanse here of the glue and the setting lotion. I'm just being a gentle, of course, because it's all around the eyes. I'm going to get some dry so that hopefully it'll help remove some of this excess glue. And I'll use my mascara wand as well, a clean one to help wipe out some of this glue. And that looks much better. Seemed to work a little bit better than yesterday too, although not great. I think I've just figured out putting less for this particular glue seems to work better. And her lashes look really nice and lifted. And what we would do is obviously present to the client because she looks awesome. Show her how pretty her lift is, and she loves it because she can open her eyes now. And then what you would want to do is remove your disposable gloves, of course, and toss them. And because she didn't have to disrobe for the service, you can just remove her headband or hairnet, whatever she might have on, her extra towel. You can let her get up, and you would be going to escort her out, reviewing any kind of maintenance and aftercare, which for this particular service, you would know that she can't get her lashes wet for 48 hours, etc. So you're going to kind of go over all that and get her checked out. Just reviewing it, she knows it. You told her they have to know ahead of time in order to be able to get the best out of the service, so she does know what she needed to do. And then you're going to go back because you have another client coming in right away for another lift. So you've got to prepare for that client. So we're going to take any single-use items that we haven't already discarded, and we're going to throw them away. We are going to find our implements, and we're going to take all the implements we use that are dirty and put them in a closed container labeled to be disinfected. All of the sheets, linens, towels, everything we use for the client would then go in that closed container in time until there's time for laundry. And then you're going to identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage, and then you're going to wipe down your workstation and area to clean it and remove any debris. Then you have to identify a disinfectant that is virucidal, bactericidal, fungicidal, EPA approved for use in a salon setting, which means you're going to have to put on another pair of disposable gloves. And you're going to read and follow those manufacturer's directions for mixing and or using appropriate aerosol disinfectant. And then you're going to disinfect electrical equipment stored in a clean area separate from other implements, and you can remove your gloves then and throw them in the trash, and it's time for you to finish, and you would wash your hands. So you are going to wet your hands, and you are going to find that liquid hand soap, and you're going to rub your hands together with that liquid hand soap down to the wrist. You're going to wash the back of the hands down to the wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash your fingertips and your nails. You're going to wash between your fingers, and you're going to wash between your fingers and your thumbs. You're going to wash your thumbs, and you're going to wash your wrists. And you're going to do all of that cleanse for a minimum of 20 to 30 seconds. When you feel like you've gotten it all clean, you're going to do a proper rinse. And once your hands are thoroughly rinsed under the water, you will grab disposable paper towels, turn the faucet off, dry your hands off completely, toss those paper towels in the trash, and then you can find your hand sanitizer that has 70% ethyl alcohol in it. You're going to sanitize your hands just like you washed your hands, so make sure you cover up all the same spaces with your sanitizer. And then when you're done, it's time to prepare for your next client that's coming in for the next lift. So that will conclude your video for lash lift.